Hello, I'm coming into the room today to do a CVC dressing change. I've come into the room and I've said to my patient, I'm Linda and I'm going to be your nurse. I verified that I have the correct patient by checking his armband and his date of birth. I've also questioned him and he's told me his name and date of birth. I'm looking over the dressing and I'm going to palpate to see if there's any pain or anything that the patient is feeling. I'm also kind of looking just to see if it looks like there's any infiltration, any redness anywhere, any swelling or anything, and it all is looking pretty good. I'm also going to verify my label to show my date to make sure that the dressing should be changed according to my hospital's policy. I'm then going to put on a mask. One thing I should have done before I put my mask on, I'm going to go ahead and open up my sterile field here. Some of my packages were opened earlier because of practice, but I'm going to start out with my Tegaderm. I'm going to open that, make sure I keep it sterile. I've also got a 2x2 piece of gauze. I'm going to open up my ChloraPrep, and then I'm going to open up my sterile gloves. I'm going to start out by removing my dressing. I'm going to loosen up the previous Tegaderm. And I'm going to go towards the middle. Once I get that loose, I'm going to put on my gloves. These are not sterile gloves to start with. And I'm going to remove my dressing change. And when I came into the room, I had also washed my hands. I forgot to say that when I started. Once I remove my dressing, I'm going to be looking to see if there's any drainage. If there is, I want to note the type of drainage, the amount, the color, if there's any odor. And then I'm also going to look over the site again to see if anything looks like it's infected or if there's any redness, swelling, and it all seems to look fine. I'm going to remove my gloves. Oh, I also should have put a mask on my patient. Normally, if a patient is able to turn his head, I would have asked that they turn their head the opposite direction, but I am going to put a mask on instead. I'm now going to open up my sterile gloves. Once I have my sterile gloves on, I'm going to make sure that I don't want to contaminate them in any way. I would then get my ChloraPrep, and I never would want to open this towards my patient or towards myself because it could spray, so I'm going to squeeze it together and then I will come in, and with a ChloraPrep you want to clean with friction. So you want to make sure that you're scrubbing the area. And I should have removed this tape. I had it on here from previous. I also want to get underneath my tubing, so I'm going to use my small finger here, or my little finger, and lift the tubing, and I'll know now that this glove has touched the tape and whatever, so it's now going to be not sterile, so I have to be careful with using it. I'm then going to take my 2x2 piece of gauze and my Tegaderm. I want to make sure that my Tegaderm, that I match it up according to my little notch on the so that I'm covering where my I'm then going to remove the outside edge here and make sure that it stays down and that my dressing is completely sealed. I would then take my label and I'm going to write on here the date, my initials, and the time that I applied and changed the dressing. And I will apply that to the Tegaderm. I'm then going to take off my sterile gloves. I'm going to clean up my area. I will remove my mask and my patient's mask. I am then going to lower my bed. I'm going to raise the sides of the bed. I'm going to make sure that my patient's call light is within reach. I want to ask him if there's anything else I can do for him, and then I will go chart my procedure. I'm going to chart the date, time, and my initials as to when I changed the dressing. I want to chart that if there was any drainage on the dressing, and if there was, the type, the amount, the color, any odors. I also want to put anything about the site, that how it looked when I took the dressing off. And then I also I guess that's pretty much it. And then I would also probably put about the procedure as to how it went, if the patient had any issues or any problems with anything during it. And that concludes my dressing change. And then I would also wash my hands before I left the room.